Patient came in with right hamstring pain, also left anterior hip pain. The right hamstring pain has been going on for about 4 to 5 months. The left anterior hip pain has been going on for about 13 months. Unfortunately, she's also noticing pain down her right leg and a lot of cramping in the anterior compartment of her tibia and fibula. That is what really bothers her almost the most, and it makes it very uncomfortable to sit or get comfortable in any position that where she's not moving around much. The patient notices that when she works out or exercises, or climbs stairs or gets in and out of a car, it's just unbearable and it's too much for her. What we noticed is that in the cause of her problem is a left posterior sacral torsion causing impingement on the left hip. That then created anterior movement of the right ilium, which stretched or tethered that hamstring, causing an injury there. She's also having iliopsoas injury on the right side in the front, which is creating right lumbar rotation misalignment, which is affecting the nerves as they go down into that anterior compartment of the shin, mainly L4, L5 regions. S1 also affected in the calf and down and through, but L4, L5, S1 are the major areas of involvement. What you're seeing with her is that left injury, which she saw PT for I think about 13 months ago, didn't quite help much, she said, but that issue, because it was untreated, was creating that buildup and that potential strain of that hamstring until there was an injury. So she was predisposing herself to injury. She's very athletic, works out a lot with a trainer, and then it was just a matter of time before she injured it enough to create a lot of torsion and misalignment in the lower back.
Here you can see the pelvis and lumbar spine. In this patient, the sacroiliac joint is the area in question. Okay, and specifically on the left side here, and this is the sacroiliac joint comprised of the sacrum and ilium. Okay, now if you look also in her, those are very restricted. It's out of normal plane of motion and therefore is not working appropriately, creating pain and inflammation and tightening of the muscles around in that area, which was impinging on this hip, which is why initially the patient had left hip pain, but not necessarily pain here, yet this was the cause of it. Eventually, what happened was, as that started to build up, okay, this ilium torqued forward out of normal plane of motion, tightening the hamstring here, as her personal trainer told her, and as the attachment for that is right here on the ischial tuberosity, the bottom of your pelvis, then she was noticing hamstring pulling, tightness, then eventually tore and created a strain sprain injury, which then also came out on the front to the iliopsoas muscle. Pretty interesting, because you're looking at something where she didn't know she had a problem here, created this, and because that created rotation and torquing of her pelvis and out of the normal plane of motion where this side came back and this side went forward, she had the hamstring injury. Therefore, that's a perfect example of muscles follow structure. The structure was off, therefore the muscles couldn't work appropriately and eventually led to injury. You know, it's just predisposed her to a certain problem. So we're going to be able to fix this by derotating the pelvis, balancing everything out, and then allowing normal hamstring motion. The other issue with her is that she's noticing neurological pain in the right lower extremity as we go down here, all the way down into the actual shin or anterior compartment of the lower leg, due to the rotation of the lumbar vertebrae on this side impinging or irritating the nerves as they go down to the lower limb, specifically L4, L5 nerves. Those are mainly the areas that are comprised or compressed the most. This is an excellent case and an example of how structurally important it is for the pelvis, lumbar, lower extremities to be aligned and working appropriately and within normal planes of motion, instead of being restricted one way and forced the other way. And you can see how the muscles respond by tightening and then eventually allowing themselves to tear or injure very easily. Her trainer noticed this and had been telling her repeatedly to come in to get evaluated, but like everybody who's, every normal person, we procrastinate. Eventually we do something about it. She had seen PT for the left hip, didn't seem to help a lot, only because it wasn't as much muscular structure. So that's why that didn't work as well. But otherwise, it would have worked very well for her. Treatment plan will consist of chiropractic adjustments to restore the normal pelvic motion, lumbar rotation, decompress the nerves that are being compressed in the lower lumbar spine, which are affecting that anterior compartment. Once those are compressed or decompressed at the spinal level, they will heal and everything will be fine there. She won't have any more symptoms down the leg. We'll be working on the muscular, hamstring apparatus to restore normal myofascial tone. She'll also be noticing that the piriformis and iliopsoas, some of these other muscles, will be more balanced and released via muscle stimulation, stretching, myofascial release, neurological rehabilitation, and then also laser therapy and intersegmental traction to restore pelvic motion and lumbar motion. All in all, she should respond very well, considering it's been there for about 13 months at least, but she did notice that there was clicking in her hip for years before that, so you can imagine that this built up slowly over time, eventually creating enough of a problem to injure herself. That's what happens to most people. Usually things are chronic, slow progressing, and they don't even know they're there till eventually, bam, something happens. That's why it's pretty important to stay ahead of problems in your body, not try to work through things as much, and just get evaluated and checked out. So keep your structure healthy, and then you won't have muscular injury as much, and you won't have disc problems, you won't have nerve irritation. And this is a prime example of that.